Today, we're going to be covering using patient journey mapping to improve digital health tool adoption. We're really excited for today's session. As a reminder, with our webinar today, you have been muted on entry and your cameras are off, but we do want to encourage you to interact and participate with us. So please utilize the chat and the Q&A function throughout the session to post your comments and ask any questions you have for CTRC or today's speakers. Another reminder is that today's session will be recorded, so if you'd like to share any of the content or revisit today's session, you can find this recording and our previous webinars on our YouTube channel. And on the next slide, just a little disclaimer. As a reminder, with CTRC, we do not provide any legal advice. And as usual, there is no relevant financial interest, arrangement, or affiliation with any products or services that may be mentioned in the presentation today. Grant language right there at the bottom. And just a little background for today. If you're new to the CTRC or need a little refresher, we have been around since 2006. CTRC offers unbiased and no-cost digital health resources and educational services throughout the state of California, and we're committed to implementing digital health programs for rural and underserved communities. You may notice that CTRC is a part of the Ochin family of companies. So our speakers today are a part of that family. And I will introduce them. Today we have speakers Angela Brown and Lulu Gonzalez, and they are part of our Ochin family, and we get to work with them at CTRC as they are both learning content designers that collaborate with CTRC and the HCCN, whom they're representing. So thank you, Angela and Lulu, for being here today, and I'll hand it over to you. Thank you.
Yay, thank you, Aislinn. So hello, everyone. Thank you so much for spending some time with us today to talk a little bit about Patient Journey Map to improve digital health tool adoption. So my name is Lulu Gonzalez, and I'm joined by my wonderful colleague, Angie Brown.
Hello.
So this is our agenda for today. First, we're briefly going to talk about digital health tools and cultural responsiveness, and we'll give an overview of Patient Journey Map and walk through a few examples. Then together we'll go through a complete patient journey map and see how this tool can help us identify the various circumstances that shape a patient experience at every step in their healthcare journey. And finally, we'll offer some resources and then wrap things up. So next slide, please.
Right, and as we heard, CTRC is part of the Ochin family. A little introduction to Ochin. It's a national network dedicated to advancing health equity. Ochin supports safety net health organizations, serve over 6 million patients in 49 states. Next slide.
So a lot of the work that you're going to see today was funded by the Ochin Health Center Controlled Network, or HCCN. It's the largest HCCN in the nation. And health center controlled networks are collaborative groups that provide no-cost, on-demand resources and training to participating health centers to address operational and clinical challenges that are related to health information technology, very much akin to CTRC and other telehealth resource networks. And Ochin HCCN supports 113 participating health centers and counting, using a variety of electronic health records and serving over 4 million patients, and it is funded by HRSA. So we do welcome you to check out the HCCN webpage to learn a little bit more. Next slide.
All right, we're ready to dive in. So we're going to be focusing on patient journey mapping today and how it aids in digital tool adoption. So first, we'd like to set the stage with some context on digital health tools and cultural responsiveness. So as you might know, digital health tools offer a great way to engage patients between office visits. This could include the patient portal, appointment reminders via text message, visits over the phone or video, and remote patient monitoring or automated care management tools. And while these tools might work really well for some patients, other patients might struggle to leverage some or all of them. And there can be several contributing factors for this. First is interest. Patients must want to use digital health tools to be successful. Other factors include patient health literacy and digital literacy levels. access to certain essentials to participate in digital healthcare, such as a smartphone, a robust data plan, or reliable internet in the home. Speaking of internet, connectivity also depends on where you live. So infrastructure to support cellular and broadband services is not evenly distributed across the country. And then lastly, there are some linguistic and cultural considerations, such as what if your patient is non-English speaking? What if they grew up with home remedies, spiritual practices, or prayer as a key piece of their well-being? What if they grew up with traditions that emphasized extreme modesty? Or what if seeing a doctor is really emphasized as a last resort? Next slide, please.
Yes. So culture can be a key factor in the adoption of digital health tools. So when providers are culturally responsive, they modify care strategies out of respect, recognition, and understanding of how someone's culture intersects with their healthcare. And it's important to remember that digital health tools are generally not designed to be culturally responsive. Often it's the empathic, personal, human-to-human support that helps patients adopt digital tools across different cultures. So, for example, we know that digital health interventions that are paired with technical support from community health workers or CHWs can really help patients use those tools more effectively. This is because CHWs can better attend to the cultural and the linguistic needs of their patients. Next slide, please. So we also want to highlight how our attitudes, beliefs, and behaviors that are shaped by our culture influence how we interact with digital health tools in really deep ways. Some of us may feel like we can't use technology very well. This has an impact on our desire and our willingness to use new tools, even if they can potentially help us. Some of us may also feel reluctant about using digital tools prescribed by our doctors after having a negative healthcare experience in our past. We may also feel like our health information isn't private or secure, or that we're really being monitored more than we'd like to be. Our culture may also determine our preference for certain tools. For example, patients with strong ties to countries outside of the US may prefer messaging platforms like WhatsApp. This can impact whether patients respond to text messages from their clinic when they're received on a platform they're really not used to using. So our culture may also determine the language we speak at home and the language in which we prefer to receive healthcare. Often, the digital tools we use may not be in the same language we're most comfortable using. For example, although a patient portal may be translated into a preferred language, the navigation buttons and the provider notes from our doctor, they might still be in English. So for many practices, it may be difficult to know just how all of these factors work together from the patient experience. Patient journey mapping may offer a way to identify how access, literacy, those cultural factors we talked about, all intersect with the patient experience. So next slide.
All right, so with that in mind, let's turn our attention to patient journey maps. So what exactly is a patient journey map? It really is a stepwise visual representation of a patient experience from seeking care, receiving care, follow-up, or beyond. Journey maps might capture broadly applicable processes such as onboarding a new patient, or they might really focus in on specific services or care offerings. A patient journey map can provide many benefits. By taking a patient perspective, journey mapping promotes and supports patient-centered care. A journey map allows you to pinpoint challenges within processes. It is possible to inventory the roles and interactions that take place before, during, or after a care episode. Health centers or clinics may look to journey mapping to apply successes to other processes. Journey mapping can be a powerful tool during strategic planning or resource allocation for things like value-based pay. And it may be possible to promote the benefits of services from tools from patient to patient using journey maps. So we'd love for you to chat in your experience with patient journey mapping. Maybe it's just piqued your interest, or perhaps it's even a common practice at your clinic, but we'd love to know where you're at with this process.
Yes,
Next,
please
please.
let's.
All right. So we also wanted to provide a high-level process for patient journey mapping before we head into some examples. So there are many ways to do this, but most approaches probably include some or all of these steps. Before you begin your effort, of course, you really need to know what experience or process you are focusing in on. So if you need help refining that, consider starting with some existing resources, such as looking back to patient satisfaction surveys or even your patient family advisory councils. Once your focus is clear, it's time to talk with stakeholders that know the experience, including care team members like providers, medical assistants, community health workers, or patient navigators, front desk staff, and of course, patients. To do this, you might hold a focus group or even individual interviews to gather more detail. And remember to try to explore different paths that might lead to the same destination. And as you do this work, document the steps along with facilitators or barriers that you identify. If you can, weave a narrative as a teaching tool. Story is truly powerful. You may choose to highlight a specific patient or a representative patient that accounts for a composite journey or something more general. As you'll see in our forthcoming examples, we really lean into the story to promote that connection to the experience. And within the journey, look for opportunities for improvement or ways to apply really great successes to other parts of your process. Consider doing plan, do, study, act cycles or other small tests of change to promote continuous improvement. And then lastly, share back what you've learned with your stakeholders, including your patients, so they can see how you're leveraging this work. And next slide. Okay, so now we have a few examples to go over that Lulu and I have produced over the last couple years. So here we have one of our very first patient journey maps that we created for an HCCN toolkit on patient engagement. It was based on some very real learnings, and this patient journey map offers a look at a fictional patient, Miriam, who is diagnosed with hypertension and depression, and her care team and that interaction over a 6-month period. We wanted to convey how a patient might interact with various digital health IT tools to manage multiple conditions. At a high level, Miriam is an established patient who is due for a wellness check, and when she's seen, her high blood pressure warrants a BP cuff. Her care manager assists her with making other appointments, screenings, and arranging a visit from mobile telehealth technicians to ensure the cuff is working properly. A virtual visit is arranged to discuss her continued high readings, and Miriam receives instructions to go to an emergency department when she has some dangerously high readings that her provider catches. Miriam's provider consults with a specialist using an e-consult for her medications, and they are adjusted. And then she receives some integrated care from a nutritionist and behavioral health specialist with individual and group therapy sessions. And then after 6 months, we get to see that Miriam has better control on her hypertension and her depression symptoms have improved. This journey map shows how digital tools like a BP cuff and virtual visits, care team connections, health information exchange, and integrated care can really plug into care planning and promote improved outcomes. Not all journey maps are going to capture ideal outcomes in a 6-month time frame, but it is really helpful to see what opportunities might exist for common subsets of patients. Next slide, please. Okay, and here is another example of a patient journey map using sequential art and text, which can really promote relatability and recall of information. We worked with 2 health centers for this one as they recounted the patient experience at their health center using the patient portal, along with the ways that they supported and educated patients behind the scenes. The characters were really developed to embody their patients of focus, and that was all the story was based on real experiences. So in these graphic narratives, we follow Shane, a newcomer to the Sacramento, California area, who has been previously diagnosed with prediabetes and is seeking culturally competent care. In addition to being new to the area, they are also new to using the patient portal and attending virtual groups. The care team helps them to go at their own pace to be successful. And this journey map really helped to display how that health center trained staff to ask about the portal at certain points in the care journey, factors that might influence a patient's decision to adopt a portal or a different digital health tool, and then showcase some message response workflows and internal referral processes. On the right, we have Rosa, a mother living in Bend, Oregon, who recently changed jobs and has to work nights. Rosa now needs a new way to interact with her care team to manage her diabetes. She must balance self-care and her healthcare, leveraging the patient portal features that she previously disregarded. Rosa is supported by health center staff to message her provider, track labs, and manage appointments for her and her son. And Rosa's journey maps how that health center initiates portal sign up, troubleshoots sign in issues, provides proxy access, and reminds patients about routine labs and appointments. And one of the advantages of using such strong visuals as a central part of the story is that we can convey not just the steps in the journey, but how things like emotions, thoughts, and other environmental factors might influence the experience. We have one more example that we are going to look at with a little bit more depth that focuses on considerations for literacy and cultural factors. Next slide.
Thank you, Angie. All right, so this is our third example that we worked on as a team together, and we're going to pause after the major steps that you see here to talk through the key takeaways and to have a little bit of discussion. So in this particular journey, we follow Ana Martí as she gets prescribed a remote patient monitoring tool to help manage her hypertension. So to create this journey map, we first had to figure out our patient population and the virtual care technology or program that we wanted to focus on. So we decided to focus on a Bluetooth blood pressure cuff for remote patient monitoring because we learned that there's evidence that uptake in the US is pretty low. Less than half of hypertensive adults engage in monthly or more home blood pressure monitoring of any kind. And at this particular health center that we made up, we wanted to see what types of barriers and opportunities would show up for a fictional patient who's adopting this BP cuff, who also has low digital literacy and who is best served in a language other than English. And in this particular journey map, we decided to go with an interactive tool so users can walk through every stage of the journey by clicking on the little green bubbles. So the little green bubbles and what shows up is what we're going to go through next. So let's meet Ana. So this is Ana Martí, a fictional composite patient who receives care at a fictional federally qualified health center named Happy Mountain Community Health Center. Ana is 50 years old. She speaks Spanish and she has a smartphone with a data plan, but she does have low digital literacy, meaning that she has some trouble navigating a website or some web-based resources. So let's jump into the first stage of her journey to understand how literacy and language accommodations help her better adopt a new digital health tool.
All right, so for this first step of Anna's journey, we really wanted to identify some of the circumstances impacting a patient's ability to access digital health tools that a clinic might offer. So we put this story together, and this is how it turned out. At the beginning of Anna's digital health journey, Anna's community health center calls to set up an appointment. The receptionist asks a few questions, including her preferred language, which is Spanish, and whether she would like an appointment reminder sent to her phone via voicemail or text message. In this case, Anna elects the text message. The receptionist encourages Anna to set up a patient portal account and fill out new patient intake forms prior to the appointment. The receptionist sends Anna a standard text message with a link and a code to activate her account and instructions to sign up for the portal that were provided in Spanish. Anna sets up a patient portal account, but has trouble navigating to the intake forms because all of the buttons and prompts are in English still. Frustrated, she logs out and ends up filling out paper forms when she arrives at the clinic on the day of her visit. Through this part of Anna's journey, the health center has asked about her language and the communication channel preferences and provided translated instructional materials to sign up for her portal. At this point, the health center doesn't know exactly why Anna did not fill out the intake forms online, but they do flag her as a patient that might potentially benefit from individualized support through a one-to-one coaching with ACHW, preferably in Spanish. Next slide.
All right, so when we started looking at this step in Anna's journey, we learned a few things. We learned that asking new patients about language preference and preferred contact method is really important. We also think it's important to screen for patient access to the internet and comfort navigating online resources. Since most of today's resources are found online, you need to know how to do that. And also offer interpreter services and furnish those resources in the patient's preferred language.
All right, so this is where we would love to hear from you all. What this might look like in your world. So these are some of the questions that we considered while we were creating this journey map for Anna. We have a poll that we'd like to launch to learn more. Aislinn, when you have, thank you. All right, so we'll give you a couple minutes, but we'd love to know if you've had experience field testing digital tools with patients. If you provide technical training to your health center staff or clinic staff that prescribe the digital tools. And then do you collect data on patient literacy and digital access?
Yeah, and so for that first question, let's say that, before you implemented a patient portal, did you test it with a few patients? So that's what we mean by field testing. Just having patients try out things before they're launched to the larger patient population.
Give it a couple more minutes. Okay, while we're maybe wrapping that up, we do want to invite you to come off of mute or use the chat to answer that bottom question about how you might support a new patient who's interested in using the portal and is best served in a language other than English.
Yeah, so what's your experience with that? I know we're working in California, so we have lots of patients that don't speak English as their primary language. How do you support patients that are really curious about using the patient portal, but the portal might only be offered in English, at least for the most part?
Aislinn, I don't know how the poll's doing, but you're welcome to, if we have most responses, we can close it. Great, thank you. Okay, so we do have some clinics field testing. That's fantastic. And right now, technical training may be on the horizon, but not at this time. Um, and we do have some folks collecting patient data on literacy and access, which is great. And about half of you are not yet, and then some are not sure. So that's awesome. Thank you for participating in that poll. Okay, and then regarding that last question, so thinking of some ways to maybe support these patients. Um, we've heard from other clinics that they kind of have this pre-set up time for them to walk through a visit together that can help them remember what buttons do what and also provide that translated instructions and common troubleshooting. I think that's one of the places people tend to get stuck. All right, we got some responses coming in. Yeah, your EMR currently offers Spanish only for your portal. Yeah. And translation service, that's perfect. That's great. I know, there's a lot of Ocean Epic members, and for a long time there was only Spanish. They recently expanded that, but hopefully more languages become available soon.
Mhm.
All right, great. Feel free to keep chatting in if you'd like, but we will go ahead and move on. Next slide, please.
So let's hang out with Anna again. So it's now time for Anna to visit her doctor. So during her visit, Anna fills out a social risk screener on an e-tablet. and selects to receive help with internet access. When Anna is taken back to the exam room, an MA asks Anna if she would like assistance with a subsidized internet plan that's available for low-income patients. Anna says that yes, she's interested. Anna then meets her new doctor. They discover that she has hypertension, and the doctor asks if Anna might be open to using a Bluetooth-enabled blood pressure cuff to monitor her blood pressure at home between those office visits. Anna thinks about it for a second and eventually says yes. Anna's provider then sends her home with a loaner blood pressure cuff from the clinic's digital tool lending library to try it out. Anna is also paired with a Spanish-speaking community health worker for follow-up to help with the social needs that she selected. And when we were thinking about this step, we thought about those individual factors that really make it easier or harder for a patient like Anna to manage her health. Things like digital literacy, language, and those minute little skills that she has to use, that she needs to use the digital tools. So next slide, please.
Okay. So we have some key takeaways for that in-person visit piece of the story. For any patient in your clinic, there are always some options to provide support that you might be able to pinpoint. Maybe not all of the things we've displayed so far, but when drafting your journey map, think about the ways that your clinic can assist patients at that particular stage with whatever barrier they might be facing. So from Anna's journey, we learned that creating inclusive spaces with materials provided in most common patient languages as an alternative to English. We want to empower patients to choose if they want to use that digital health tool or not. So Anna had the option. It wasn't forced upon her. And if they do, it's a good idea to ask if they would like extra support, if you can provide it. And then if they do want that support, can you pair your patient with a community health worker or some other role that might be able to offer some digital skills training after the tools prescribed? Offer patient-facing materials in preferred languages at the appropriate reading level as well. And then if access to the hardware is an issue, consider kind of creating a one-stop shopping model. For example, some Ocean Health Centers who cater to populations who are houseless try to pack everything into that one in-person visit. That's their one chance to kind of get them signed up for the portal and then connect them with resources like issuing a subsidized phone with a data plan. Next slide.
All right, so these are some of the questions that we asked ourselves when we were developing the clinic stage of Anna's journey. So when she's seeing her doctor. And now we'd like to get your juices flowing with another short poll and discussion for you. So we want to know, do you use virtual interpreters at your health center or clinic? I know someone said that they do, so I hope that person says yes. Do you survey patients about their interest towards using digital health tools to manage their health? And do you screen for broadband or internet use? Or I'm sorry, not use, access. We know some clinics do, some don't, so let's see what this group says. So we'll just give it a few minutes.
This is where I wish we had permission to use like some funky elevator music as we're waiting, you know?
So after you're done with that poll and answering those three questions, we have another question for you that you can type into the chat or come off mute. We'd love to hear your voices, not just ours. So what are some alternative supports for patients who do not want to use digital health tools? So if Anna had said that she did not want to use the BP cuff, how could you keep track of her blood pressure readings? I mean, Anna still needs to take her blood pressure. So what kind of alternative supports can we offer her? All right, so those poll results are ready. Exciting. 79% of folks here said that they do use virtual interpreters at their clinic. Oh man, and almost an even split between clinics that survey patients about their interest in using digital health tools and those that do not quite yet. Hmm. And then do you screen for broadband access? 42% said yes. That's great. Yeah, that's great. How can a patient use a portal if they don't have broadband access of some sort, right? Or a data plan? So it's good to know that before we offer those resources. Okay, great. So when thinking about the chat question, what are alternative supports for patients who don't want to use digital health tools? We often think about, are there family members that can support Anna with this? If not a Bluetooth cup, can she keep a written diary or a log? Can she go to a local pharmacy like CVS to use one of those little machines? Let's see.
Yeah, this goes back to that patient journey mapping, different paths. There might be some other options because digital health tools are not always going to be ideal.
Mhm.
Yeah.
Oh, well, great. So perhaps Anna may like to be taught to keep a blood pressure log. Yes, and would agree to discuss over the phone during a telephone call. That's great. Alternatives might include home health clinicians to visit the patient. Yeah, lots of good options. Okay, well, thank you everyone for answering the poll and those questions. All right.
Okay, so let's look back at Anna's journey again. For this stage, we asked, what external community partners and other resources does Happy Mountain CHC have to help this patient? What barriers are there to adopting this new BP cuff? So, after a few days after her clinic visit, Anna gets a phone call from community health worker named Patricia from Happy Mountain CHC. They plan to meet at a library so that they can leverage that free Wi-Fi. First, Patricia shows Anna how to use her phone to fill out an application for a subsidized home internet service. Then Patricia explains how the Bluetooth BP cuff works, what the numbers mean, and gives Anna a wallet-sized card that uses a stoplight color motif for the BP ranges, something very recognizable. Then they practice using the cuff and to take Anna's blood pressure and transmit the readings to the EHR. Next, they use Anna's phone to take a little tour of the patient portal, and Anna learns how to find her inbox, message her doctor, and look up test results. So as they chat, Patricia learns how much Anna really values her community and how much she loves cooking. Patricia gives Anna information about a local group, Familias in Acción, that offers culturally appropriate nutrition and cooking classes for people on low sodium diets. Next slide. Okay, so some key takeaways from that follow-up with the CHW. Um, we can really see that that digital inclusion piece is super important, and you can see that human-to-human contact really is helping Anna to feel um, more comfortable using the technology. So, when CHWs and patients share those cultural roots, fluency in the same language, or maybe some common lived experiences, it can really help to establish that trust and willingness to troubleshoot those kinds of tools. Human supports and training improve adoption and utilization of digital health tools, offering a little illustrated or color-coded patient materials to support care management, like that stop sign or that stoplight motif is preferred languages, and appropriate reading levels can really help supplement that care as well. And then explore community-based partnerships that help address patient needs beyond the clinic, kind of like that community center that offered the free cooking classes. Okay, next slide, please. All right, for this one, we don't have a poll, but we would love to hear your thoughts on what if you don't have some amazing cultural resource center in your community and you have a patient that would benefit from some type of support, what would you do then? Just love to crowdsource some ideas.
Yeah, these are just some of the questions that we had to ask ourselves when we were putting together this journey. We had to think about what resources are available at those different levels. What resources are in the clinic, in the community, in your town, city, county, you name it. Sometimes we don't have too much locally, so we have to look a little bit outside of the box.
I see, Liz Morris. There might be some chats that are going to individuals, so make sure that when you post your chat, it says to everyone, please. But yeah, that's it's a hard conundrum for a lot of clinics. I think that there aren't a lot of resources available all the time. So there's definitely looking, might not be as ideal as in person, but there can be virtual resources and more regional resources and partnerships. Sometimes even like universities might have programs that students can support patient engagement and or mobile clinics that might be able to go to the patient. Um,
Oh, and that's what Jessica just said. Jessica says we lean on our social services department to really help us connect our resources in our community, like county services and universities. So cool. And
yeah.
Lashonda says, ask your community leader, alderman, mayor, could these resources be introduced if there is a higher need that may benefit a few? Yes. At
Yeah, that
social action.
advocacy.
Mm-hmm.
Yeah, and collecting that data and it really can help you tell that story too. Having these experiences documented and having that data at the ready can help advocate.
Mm-hmm. And Liz is our partner today. She even offered a link. Potential partners, affiliates of National Digital Inclusion Alliance. And Jessica says libraries can be a really good resource as well. Yeah, that ties in really well to our next question. What are some community-based resources that help patients access digital tools? Libraries often offer free resources. So do local communities, or I'm sorry, local community colleges. They offer free computer literacy courses for adults in multiple language, oftentimes. Yeah, schools, the YMCA. We've even heard of some community health centers that invite high school students to help patients navigate those digital health tools as part of like their community service requirements. So that's pretty neat. Yeah, we've also learned that sometimes the digital tool vendor or manufacturer will offer some coupons to reduce some of that cost for the tools.
Or lending libraries. Sometimes you can pull resources and have temporary digital tools available to lend out to patients.
Yeah,
Yeah.
right. Oh, and then finally, LaShonda says some community or local EMS may be able to help. Yes. Awesome. I think everyone is ready to journey map now.
Yeah, so speaking of that, hopefully you're all convinced that patient journey mapping, whether it's really story-based like the ones we showed or more process-based, hopefully you're convinced that it's worth a try. So we do have some tips for you on how to execute them at your clinic. We'll really drive home that clearly defining your goal ahead of time is really important. It's going to be your guiding star. Engaging patients and staff by sharing the why behind the work sometimes can really elicit more deep responses and more thoughtful interactions. So that can be really powerful. Remember to get feedback along the way. So maybe as you're drafting or you're at your like almost final stage, be sure to share that with some of your stakeholders to make sure it's aligned with their experiences. Adding visual interest is really helpful for memory. It's helpful to keep the reader engaged. It doesn't have to be elaborate. Sometimes it can just be a matter of color coordinating or visual organization, but it can be really helpful. And then sharing that journey map or the work that came out of that journey map with the appropriate audiences can help, just like the advocacy piece, it sort of helps composite your story over time, looking back as a benchmark for improvement. And speaking of that, update. So if you do a journey map and maybe the process changes, be sure to return and see if that experience has benefited or if there's new opportunities there.
Hmm. Yeah, and Jessica is my buddy here. She says there are some nice templates available. So we've actually offered some templates here. Um, so the second template is actually my favorite, but I'll go through all of them. Um, so we have a toolbox from the National Health Council on mapping a patient's experiences, and it's more diagnosis based. So you help map the patient's experience before getting a diagnosis, while getting a diagnosis, and then living with a diagnosis. We've also shared a worksheet that helps providers identify ways to support virtual care equity, kind of like what we did here for your particular patient population. It's my favorite resource. It's so um, easy to use, and any team member can use it. And finally, we offer a great example of another patient journey map on substance use disorder treatment and recovery experiences, and that's in that final link. Yeah. Oh, yeah. Can you share the links on the shared links? They're not highlighted. Yeah. I think we're also sharing the slide deck um, after we close out, so those links will be available, but I can try to drop them into the chat now. All right. And I think Angie and I spoke really quickly. We were excited. So if you have any questions, we can stick around for a little bit. If you have any ideas on patient journey map at large, let us know. We're here for a few minutes. So either way, thank you so much.
I did go ahead and post the links into the chat, so hopefully, oh, I think some of them did not copy over, but we'll make sure if you are here today, you will get an email when the recording is available. You'll get a copy of the slides and all of the materials from today. We'll make sure you get a hold of those. And please, if you are not, please subscribe to our newsletter to stay informed about our upcoming webinars, new resources we have coming soon, and just stay connected with us because we'd love to share all of our resources.
We have time for questions if anyone has them as well. And I did see a question in the Q&A from Lashanda. Is patient journey mapping similar to an SDOH tool to determine the conditions in the environment that may impact a patient outcome? And I would say most definitely. It's, rather than being a screener, like it'll be a look back at an experience, and then hopefully you're able to drill down at some of the barriers and maybe identify where those SDOH, like social risk factors, might be coming into play. So I think that they're very complementary.
Yeah, I would also say that, I mean, if you are looking to implement an SDOH screening workflow, patient journey mapping is also really good for that. So, I mean, you can use it for so many things. We love it. We've obviously made a few examples, so yeah, we hope you use it.
Right. Any last minute questions, audience? This is your time. I will also encourage everyone who's here today, in addition to our newsletter and our website, you can always reach out to the CTRC via our website. We do have a phone number available and a direct email. So if you have any questions for CTRC or our presenters, we're happy to pass those along or get in contact. So feel free to reach out to us offline as well. I'm not seeing any additional questions come through, so I think we will give everybody the gift of 15 minutes back in their day. And I'd really just like to thank Angie and Lulu for joining us not once, but twice in August to share some really great information to our network. So thank you both for being here. It was a very informative presentation. So thank you.
Thank
Thank
you all
you.
for coming. We appreciate you.
Yeah, thank you.
And Mariah, you're in charge, so you have to stop.